Hello everyone, this is Dr. Ritesh Reddy, consultant gastroenterologist. So today we'll be discussing about constipation. So what does constipation mean? If a patient is having less than 3 bowel movements in a week's time, or if at all the stool is very hard in consistency, or if at all the patient is putting a lot of pressure when passing the stools, or if the patient is having difficulty in having a bowel movement which is needing a rectal evacuation via a digital manual evacuation, all these things are considered as constipation. So what are the common reasons why a patient will be having constipation? If at all the patient is having reduced fluid intake, which means if he is dehydrated and not taking adequate amount of fluids, which is less than 4 to 5 liters of fluids per day, or if at all the fiber intake is reduced, or if at all the patient is having any other problems like a hypothyroidism, where the thyroid works very less, or if the patient is having any other diseases like Parkinsonisms or multiple sclerosis, all these are some of the causative factors why the patient will be having constipation. So what are the lifestyle modifications which the patient can follow so that the patient will have a free bowel movement? Patient has to increase his fiber intake, which is in the form of fruits like papayas, watermelons, green leafy vegetables, also vegetables and seeds and legumes and all these things. The next one is the fluid intake, which means the patient should have at least 4 to 5 liters of water intake per day. The next thing is mobility, which is the patient should be actively walking for at least 30 minutes every day, with which the gut motility will also be increased. So when should you consult your doctor for constipation? If at all the patient's age is more than 45 years, or if the constipation has been happening for more than 3 months duration, if the patient is having unexplained weight loss, which is more than 10% of your current body weight, or if the patient is having any bleeding in the stools, or if at all the patient has a family history of colon cancer, all these are the risk factors in which patient can be having a possibility of colonic polyps or a colonic cancer. So what do we do in these conditions? First, we encourage our patients to increase their fiber intake, fluid intake, as well as their physical activity. The next thing is we usually start patient on a couple of medications like a bulking agent or an osmotic agent, which will help him or her in having a free bowel movement. The investigation of choice, as discussed, would be a colonoscopy test where we put a small camera from the rectal opening and we examine the large intestine. If at all the patient is having any colonic polyps or colonic ulcers or any colonic cancer features. If at all the polyp is in an early stage, we usually remove it with the help of a colonoscope so that the disease will not be progressed into something risky. So thank you everyone.